Hey, it's Birdman. Time for another Summit Healthcare's here at Angie Fabian's office on the 5th floor of Summit Healthcare. I don't know if you've been noticing, but there's a little bit of construction going on next door. We're going to be showing some of that coming up, but pretty crazy stuff. I've got with me today Mr. Troy Layton. Is it Layton? Yes. How are you today?
Doing well. How are you doing?
I'm doing pretty good. So you do, and it was funny because when you came in, I said, "What's IP dialysis?" And you said, you kind of looked at me confused, and it's not a normal term.
Right. I've never heard IP dialysis, but you and I figured out together that IP, I'm sure, stands for inpatient. Somebody had sent that abbreviation to you.
Right.
But that strictly refers to the fact that we are offering dialysis only to people that are actually patients here. Some people need dialysis 3 times a week and get it in the outpatient setting, so that would be outpatient dialysis. Where once we have a patient here in the hospital, whether they're a dialysis patient that comes in and then needs a hospital stay, they can receive it. Or if somebody shows up here and then they have some kidney problems, we can provide those dialysis to those patients. So it's strictly for patients that are in the hospital. That's what the service I'm providing. Okay.
So take me through how you got involved in that. Where did you start your medical career, and then how did you evolve to this position here?
Okay. When I was about 10 years ago, I went through a midlife crisis and became a nurse. Shortly after getting out of nursing school, I went into an outpatient dialysis facility, and I spent 8 years there and worked as a nurse on the floor. There are a lot of shortages in that area as far as employees, so oftentimes I would do technician work as well. So basically the full spectrum of what's done in an outpatient facility, I'd done all those things. I came in contact with somebody here at the hospital, or they came in contact with me. They were having some issues with continuing to provide inpatient dialysis by contracting it out to somebody, and we got into discussions and found that it was something that I felt I could do, is come in and actually create a program from the ground up. When the other folks left, they took all their toys and went home, and I came in and began by creating a policy and procedure manual and some various things. So it was a little bit of time in getting up and running. I've been here 8 months now, and we did our first treatment earlier this week.
Oh, very good. So now this dialysis, I'm kind of interested. Do you have a location within the hospital facility where they come to you, or do you go to them, or how does it work exactly?
That's the really cool part for the patient. They just stay in their room, and dialysis requires pretty much the planet's perfectly pure water. So I have a water purification system that's portable that I roll into the room, and then the dialysis machine is a separate machine. Side by side, those two are able to help me provide dialysis to the patients. I hook that water purification system, it's a reverse osmosis RO system, up to the sink, and then we get that pure water, and it comes over to the dialysis machine, and there's a mixture made with that pure water to make what's called dialysate. And the dialysate is a mixture that has the electrolytes of your blood at the levels they should be. And basically, as their blood runs through a filter, there's a semi-permeable membrane, and the dialysate is able to balance those electrolytes, and that filter is able to clean the impurifications out of the blood at the same time. So when we urinate, we get rid of waste, but our kidneys also help balance things out for us, create a term called homeostasis in healthcare for our body. But the two machines help me do that.
Wow. So dialysis is basically, if I understand it correctly, it's taking over the function that the kidneys aren't doing properly.
Yeah.
Is that what it's doing?
That's exactly it. And you know, there are multiple issues there. The ones that are probably most common that we could think about without getting into too much detail is removing fluid from our body when we urinate, as well as clearing waste and sending waste out of the body with that. There's some other functions in there too, but to keep it simple, those are the main things that we're taking care of. We're clearing the waste and getting rid of some fluid. So that dialysis machine, you have that filter there, but it also has a mechanism that as the blood goes through, it actually draws fluid out of that blood and sends it down the drain as well. So you're cleaning it, and you're getting rid of some fluid. I've had people that have lost as much as 7 or 8 pounds.
Really?
During a 4-hour treatment, just sitting there because we're pulling that much fluid out of the body.
Don't tell people that, because then they'll know it as a.
It's not a weight loss. It's not a method of weight loss.
I don't think it's a weight loss program you want to get on. No.
No.
Yeah.
No.
Now, so That's interesting, and it's just that once somebody's on dialysis, let me ask you this: does the kidney ever heal itself and then you get off dialysis, or is it pretty much once you're on it, you're kind of on it or need it more?
And that's the two different types of patients I talked about. There are those patients that are chronic, and they go to an outpatient facility nearby. There's one in White River. There's one in actually, there used to be one in White River. There's now just one in Show Low. So we have White River patients and Show Low patients attending this facility on White Mountain Boulevard. Those patients, when they come to the hospital, yeah, they're going to need it, and they are chronic. They will require dialysis for the rest of their life or until they get a transplant. But some patients that show up here to the hospital, there can just be things going wrong, and the kidneys can be troubled and having some problems. We call those acute patients rather than chronic.
Okay.
And sometimes we'll put a catheter in up here, and we'll be able to access them and draw that blood out and clean it. But then a lot of times their kidneys can recover. So hopefully that's the hope. When you first have that bad experience here, the hope is that you're going to be one of those folks that doesn't have to have it continuously.
And not only say that for those that because sometimes you hear, and not everybody gets access to information, but they'll hear, oh, this person wanted dialysis, and they're like, oh, great. Now they're going to have to get a kidney transplant, and that's immediate thought when you don't know anything about it. So for those that might not be a direct relative or something like that, there is hope that it could be something different.
Well, usually it kind of goes a little bit the other way too, though, because usually when you hear that your friend is on dialysis, that means that they're visiting one of those outpatient facilities. And I would say more than 99% of the time, from my experience in the 8 years that I was out there, once they're in that dialysis facility, recovery is probably not going to happen. They're going to need a transplant. But if they hear that their friend was at the hospital and they had to have dialysis, those are the ones that may not have to attend the facility once they leave. We might straighten it out while they're here.
And if you're at the point where you need a transplant, is it because if you get a transplant, you give up a kidney? You can give up a kidney and work off of one kidney. Does that mean that both kidneys are bad, or is it just one's not able to keep up with your certain level, or what are the parameters there?
Well, typically when somebody goes into kidney failure, it's going to be both.
Okay.
And one of the things that's interesting, this is something that is worth advertising. If you ever give your kidney to somebody else, and then the kidney you have remaining goes bad, you actually go to the top of that transplant list.
Oh, wow.
And for most folks, if the people who have their kidneys have gone bad on them, and they're looking for that transplant, these are all the patients in that outpatient facility. They go on a waiting list, and that usually takes anywhere from 3 to 5 years that they're on that waiting list. But if you've been willing to give a kidney and then the one you have left goes bad, you'll actually go to the top of the list and you won't be waiting long.
Wow, very interesting. Cool. So what else would you like people to know about the facility here and what you do at Summit Healthcare?
I think we've mostly covered it. I can say this: it's been a great experience. It's been phenomenal to come into a healthcare facility that I've received so much support from the upper management in this facility in getting a program up and running. That's not something that was really easy. We're doing this through telenephrology. I guess that's something else to add to that, in that there was a time in the past where we had a nephrologist here in this community that serviced the community here at the hospital. At this point, we are utilizing 4 doctors out of Flagstaff, and these nephrologists provide a service through telenephrology. So they're still able to communicate. It's kind of like Skype, only you can also hook a stethoscope up, and they can listen to the patient, and we can help them truly assess the patient, talk to the patient, work through the process. So that's a really nice thing too. Other than that, it's like I say, getting set up here, getting the policies and procedures in place. I have another nurse that I'm training, and eventually there will be 2 of us that will be able to offer this service here. Right now, if you're coming to the hospital needing hemodialysis, I'm going to be the nurse that's actually performing the procedure. But
okay, that's very cool. So that's neat. Once again, telemedicine. We're here talking about that, and the fact that it's allowing us to connect to people that aren't here, and not have to staff somebody and not worry about and also there's probably backup, like you said, with a couple doctors. So if the one isn't available, the other is. You've got that almost 24/7 availability, and it's somebody that's getting a lot of different cases, so they know what's going on.
Absolutely.
Cool. Anything else, Troy?
I think that's it. It's a good thing to have it here in the community. I think about it just from my vantage point. You know, you have family members in the area, and if something goes wrong, you don't want them being put on a helicopter every time. And unfortunately, for the last 12 months, that's what we were doing. If you needed any nephrology services or you needed dialysis, we were putting you on a helicopter, and you were headed off to the valley.
Wow.
And now we're going to keep a lot of folks closer to home.
Very good. Thank you very much for your time today. Appreciate it.
Thank you.
It's Troy Layton with the In-Patient Dialysis. Just reminding you of the services here at Summit Healthcare and the fact that we want to keep the people here on the mountain. So, if something happens, as much as possible, you're able to stay here, stay with family, stay connected to your community. And that's why it's Summit Healthcare, and reminding you, be healthy.